I'm here at the annual meeting of the North American Menopause Society, and I am speaking with...
My name is Dr. Holly Thomas, and I'm an assistant professor of medicine at the University of Pittsburgh.
And I heard a really wonderful discussion from you about midlife sexuality, and I wonder if you could share some of the key factors.
Sure. So the study that I presented today was a study in which we conducted individual interviews and focus groups with women between the ages of 45 and 60 to get a better handle on what types of changes women experience in sexuality during their midlife years.
Mm-hmm. And this is more about perimenopause, really the window leading just up to and just beyond the change.
Right, so because we included women between 45 and 60, average age of menopause in the US 51, 52. So we had women who were both in the perimenopausal stage, but also postmenopausal as well.
How did things change for these women?
Right, so we found a few things. One of the things we found that we weren't necessarily surprised by was that some women do experience negative changes in sexuality as they go through this transition. And that's something we've seen in prior studies as well. Women talked about difficulties with vaginal dryness, lower libido, and just having sex less frequently than when they were younger. But what we were more surprised to find was that there were substantial numbers of women who discussed positive changes that they went through as they got older. So women had a few different things that they attributed these changes to. One of the things that women told us was that as they got older, they felt more confident and more comfortable in their own skin and their own bodies, and this allowed them to be more free in their sexual expression. Another thing women told us is that they felt they had a better understanding of their own bodies and better self-understanding about their own sexuality as they got older, which helped increase their sexual satisfaction with their partner. And finally, women told us that their communication skills improved as they got older, and that allowed them to discuss what was working for them and not working for them in the bedroom.
They could ask for what they wanted.
They knew what they wanted as they got older, and they felt more empowered to ask for what they wanted as they got older. So both things were important.
Now, one thing you commented on is that women sometimes had less frequent sex, but yet did not feel any less satisfied in terms of their experience. Could you talk about that?
Sure, yeah. So we had several women that noted that while they were having sex less frequently than when they were younger, their sexual satisfaction or the enjoyment they got from sex was just as good or even better than when they were younger. So for these women, quality is more important than quantity. Anything
else you'd like to share?
I think we should just, as healthcare providers, remember that each individual's woman's experience as they go through menopause and the midlife years is unique, and not all women experience negative changes in sexuality during these years.
Thank you very much.
My pleasure.